7 years ago, I lost my father to poor healthcare. The enemy in Edo here had struck, and my dad had a swollen jaw. Diagnosis later proved that he had Longus angina, which wasn't proven by any hospital here anyway. It was proven by Google. We had to check Google later. And in the course of trying to get my dad medical care, time was wasting. Eventually, we tried to import a doctor from Delta State into Edo State. But to cut the long story short, he didn't make it. I believe that if proper provisions were made, if enemy wasn't on strike, and even in the hospital we eventually rushed him to done proper diagnosis, my father would have been alive. I'm certain of that, because he was a strong person. I've also had to experience what it means to lose some other persons to the cold hands of death, which to me was occasioned mostly by negligence in the part of our leadership process, because a good leadership process must take into account the lives that he or she is administering. So people have to stay alive. You have to have numbers for you to keep basking the euphoria of your leadership. You should not even take pride or glory in their death. And so there's this young girl that for 4 years, if you go to my Facebook wall, Kumbo Apollo, and you will see I use my personal Facebook wall as campaign because I have nothing to hide. Some person say open a new page. I'm like, I don't. And so I've been raising funds for that young girl for the past 4 years or so. She had kidney disease. Every attempt we made to raise funds for her wasn't really getting good response. I had even met some celebrities here in Edo to use their platform to raise the voice and get her more help. Well, they weren't willing to. And for every time we raise funds, we send over, she does dialysis. For every time I hear from her, I'm always afraid. And she writes to me and tells me the condition of things with her now. So just kept trying to raise money for her. She eventually died. I think last month. She died last month. And I'm thinking that at the point of her death, something in her probably must have told her, if they had treated me, maybe I wouldn't have died. And so it dawned on me that when the sons and daughters of the ordinary people come down with a lifestyle disease, the one they call big man disease, hearts, kidneys, liver-related diseases, strokes, hypertension, cancer, diabetes, whatever disease that the sons and daughters of the ordinary man comes down with, because it's expensive to take care of, automatically it becomes death sentence. So as I speak to you now, there are a lot of persons already on death row. They know they're going to die because help is not coming. There's no availability of money, and there's no government policies to give them the hope that something's about to happen. So there are a lot of persons counting on you and I to make good decisions so that they will not lose more of their loved ones. It is in the face of all of this that I had to go into some real deep thinking, and I'm like, we can actually create free healthcare. Yeah, we can. It's just, when you stop stealing from the people, you will direct their resources, all right? So I designed a project, one I hope to name after the late girl, or perhaps after my father. I designed a project wherein the sons and daughters of the ordinary people can achieve free healthcare. Now here's how it works in my understanding. The bricklayer out there, the painter, the electrician, the mechanic, the taxi driver, the store operator, the business owner out there, whose businesses cannot afford millions to take care of their sick ones, especially if it is a lifestyle disease. It is because of these people that I had designed this project. For example, let's take this. I don't know the number of taxi drivers that work in Edo State. I also do not know the number of workmen in Edo State. So I met a cabman. I took his car. So I was asking him, what is the chances that you could have free healthcare? I'm like, no, does it work? Does it work? I'm like, yeah, it can work. Free healthcare can leverage on the people's taxes. If a government means to be sincere, they can do it. And in my own opinion, this is how it works. You see that bus driver that you cut tickets for every day, even while the roads are spoiling his vehicle, but you keep taxing him tickets. Let's use him as a case study. From there, you can look at other sector by yourself. The bus driver works every day. So is his conductor. They both work every day. They don't fall sick every day. But every day, they pay taxes for plying any of the routes across the states. Assuming, for example, that a bus driver was paying a ticket of like, let's say 400 naira to run the route, and you and I know it's way more than that. Way more than that. Imagine if government was to stop using this collection of tax to empower their political cronies or those that help them during elections. If government was to collect these taxes directly or through a means that is really duly accountable, you can save up, let's say 30% of whatever you tax these people every day or every month. 30% of it, you can save it up in an account where the money is just stacked. It's just left there. Nobody's touching the money. So the moment you pay taxes, there is a tax derivation formula wherein 30% goes to XYZ accounts. Such accounts will invite people. Everybody lost residual money. Even the banks will come frolicking. The financial institutions will want something. But then, another group that wants something is the health management organizations. I always say that the big man is not coming to come and help you with his money. If a big man comes, he's going to come and invest because he wants to make more money. So nobody should wink us with this title of, okay, I'm a big man, I'm going to attract investors. Government as a structure in itself will attract every single person. Not talk of an idea-driven government. It will attract even Bill Gates to come to Benin. If Bill Gates begins to hear of the things happening in Benin, in tech world, for example. And so the HMOs will begin to breathe on this. And because this money is coming in daily, and those whose heads it to be managed are not falling sick daily, naturally, government can set a standard. Okay, you can bid to manage the health of all mechanics in so local government. You can bid to manage the health of all painters or carpenters or electricians. You can bid to manage the health of all drivers in this local government. Now, government now gives you a condition to go and get a health facility ready for it. There are some things government doesn't need to spend money on. Government just needs to put the policy out there. People come and spend this money. Now, you will see people coming rushing in because there's money. It's not like you are waiting to treat somebody and then get paid. No. They understand that because these persons are not falling sick every day, the monies they are getting are literally free money. So at any point in time, you come up with a lifestyle disease, or at any point in time you are sick, it's just a question of taking your identification card to the clinics designated to take care of your health. And if you are distance away from the clinics designated by the HMOs that won the bid to build well-kitted facility, because at that time, government can tell you have to put this, make sure there's this, so you can get the license to manage the health of these people. Now, because these monies are there, government can also create it such that if you have an emergency, you can be rushed to any facility closest to you. If the one that you're registered is far from you, they will treat you by just identifying you and take the financial sum from the one who manages your health. That way you see that there's conscience people shouldn't just die like that. I don't agree that people should just suffer and die. I don't agree. I don't also agree that government can't do these things. They are doing a lot. Look at the Pensions Act they amended for themselves. In the Pensions Act, they wrote that governors and their deputies are entitled to free health care across the world. Not even like they localize it to Central Hospital here. Anywhere in the world on your taxes. So why shouldn't your taxes now work for you on free health care? Why? Should it be that the big man and his friends and his type are the only ones that came to this earth alone? I mean, we all breathe the same oxygen. I don't think they are better than us. We are more in numbers. Where it hurts us, let's go look at that place and let us make things work for ourselves. There is a much more robust practice to this healthcare that can generate so much money. But I told myself I will not discuss that one publicly. Somebody could start it tomorrow and become a billionaire overnight. It's easy to actually start. It's a model I drew out, but I've not thought of making money at the expense of people. I want to use it for people. I want to use it, so that's where I will get my satisfaction. But if I discuss how to really control health practice, somebody will start it tomorrow. Even before we become government, someone will start it. And I discussed some of these things with some members of the NMA, and they agreed with me that the whole Japa syndrome thing will abate because there is liquidity, there's equipment. I just feel like the ordinary man and his family deserves government's attention, especially as it concerns their health. Do you know how sad it is that you've had an accident and you are not dead yet, but you just know you're most likely going to die because the healthcare system is poor? You know how many friends, I have 2 friends who have lost their wives to the mortality rate in childbirth occasioned by childbirth. Just went to the hospital by themselves. Healthy legs went there, and from there they rolled them to the morgue. Our healthcare system needs serious input. It's not fine English. It needs serious input. Serious input. If you drive our healthcare, add to whatever it's on ground now, to what I'm bringing on board, you will see that the healthcare system will be better. And like I said, I'm refusing to discuss even down to diagnosis. There are ways I commoditify diagnosis. You can get diagnosis anywhere, anytime in the world, and get super paid if you're a healthcare practitioner. There are ways you maintain people who living with lifestyle diseases. There are ways you get identification and maintenance for diabetic patients. And I just came up with a robust thing, that I feel could work or should work in the health sector. And I'm simply asking for your opportunity to bring this to reality. I just don't want to see ordinary people dying and wasting, because if anything happens, these guys, they go abroad. They go procure the best healthcare. Everybody in this race now, I'm not correct, it's not everybody. The major contenders in this race are billionaires. They can afford healthcare anywhere in the world. They and their deputies can. I don't know if you can. So if you cannot, join me. We deserve a better life. We deserve a healthcare system that works, a healthcare system that generates its own wealth and solves its own internal problem. Edo will be a destination of doctors, nurses, and healthcare practitioners. I promise you. Edo will become the destination, and there will be several healthcare centers everywhere. It's not just government building hospital specialists here. Go build one in another central district. If you just use the ideas to drive the policy programs that I'm trying to do, you have a lot of big, well-equipped hospitals everywhere, because HMOs will come in. It's not because they love you, but because they want to make money, and because we have reserved your tax. Everybody loves to breathe on such reserves. So I think an Edo that solves healthcare challenges is possible.